Hi, I'm so excited to be here with Dr. Jennifer Cruz, who is a doctor of Chinese medicine and acupuncturist. And here we're going to be talking about the integration between the mind and the body and spirit. Jen, would you like to introduce yourself?
Absolutely. First and foremost, thank you so much for having me. I'm really excited about this conversation and to dive in. A little bit about me. I am as you said, a doctor of acupuncture and oriental medicine. I have a postdoctorate in COVID research and a doctorate in women's health. I am founder of Acumantras, which is a nonprofit providing accessibility and affordability of East Asian medicine. We're currently spearheading an endorsed community clinic program to get our colleagues and all of those amazing providers within our communities involved in this mission. So I'm excited. I'm also co-founder of Eastern Acupuncture and Wellness, which is a primary care office specializing in acupuncture and oriental medicine, and I get to work with some brilliant human beings and practitioners. We're an all women based practice, and we're all about empowering. And we treat anywhere from infancy to geriatric and everything in between. So that's a little bit about me, and I am excited to share more.
Amazing, amazing. When I work with clients, especially the women that I work with, I'm always curious to see how their physical health is doing. Especially when they're complaining that every time it's that time of the month, the week before they're getting their period, they're starting to have their symptoms, and that includes the flashes, the headaches, the tiredness, the soreness, and of course, then the emotional issues where they're getting depressed or anxious and fighting with their loved ones, their kids, their spouses, etc. And I know for myself, it's one of the reasons why I came to see you a few months ago was because I was feeling all out of sorts. And the acupuncture has helped me tremendously to start regulating my body from the inside out. And I tell a lot of my clients, well, I tell all of them, is that it's not just one thing. You can go to as much talk therapy as you want and talk until you're blue in the face about the problem. But if you're not dealing with it holistically, you're only tackling just one part of it, and it could take forever because there's other things that have to change within. So I wanted to have this conversation with you for those who might not really know about the mind and the body connection and how emotions are actually working through us and for us, and how working in tandem can help women, and like you said, even the babies through geriatrics, get through lots of concerns that perhaps they didn't even know that they could get through acupuncture.
Yeah, it's really interesting because with, I guess, first and foremost, emotions lie in our cells and traumas lie in our cells. So, on a cellular level, oftentimes we can't even articulate where those blockages are or how they're affecting us until we start something like talk therapy. And even then, we're going through it, but how acupuncture really helps to foster um, movement is it does exactly that. It stimulates blood flow, and those cellular traumas lie in our blood. So when we use certain areas of the body to inoculate or to put an acupuncture needle in, we are literally using our brain is then saying you have a foreign object inside of you, so let me stimulate the heart to pump blood throughout the vessels and the arteries to protect the body from that needle. And in turn, that circulation of blood flow stimulates a parasympathetic response. It brings the nervous system into rest and digest, where most of the time, we live in fight or flight. So by creating circulation of blood flow and reducing the nervous system to a state of relaxation, our peristalsis of our intestines function optimally, so we're able to digest our food better, and then that food is able to turn into the nutrients that we need to support our nervous system, our musculoskeletal system, our endocrine system. Um, and I can go on and on and on. But acupuncture is one of those non-verbal ways of healing that really pairs very well in conjunction with talk therapy.
I mean, you just, as you were talking, I was thinking about IBS. I was thinking about people who suffer from a lot of the other digestive issues. I was thinking about anxiety and depression. And when you're talking about the parasympathetic nervous system and getting us to a place of relaxation, most of us don't even know what that's like. We live in such a fast-paced world, and for many people, and I don't think it's just women, but for many of us, the more we get done, the prouder, the more pride we have. You know, the more things we check off our to-do list, the better we feel about ourselves. We might even be adding, I know I used to do this, add more things to the to-do list so I could just cross it off and be
Brush my teeth, check.
yeah, right. And then we go to acupuncture and, just lay there and have these very thin, non-painful needles to relax. And the body sometimes doesn't even know what that feels like, what that's supposed to be, because we're so much on the other side of it with the sympathetic going, 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 that even when we're sleeping, we're still restless. And it becomes this hamster wheel where we just go, go, go. And the body begins to have these symptoms and it wants to shut down, or it starts having these warning signs go off that I'll speak about it from the mental health aspect, that then people want to rush to take medication or rush to fix it, to make it go away, without necessarily taking care of why it's showing up in the first place. And for me, what drew me to acupuncture and also the Oriental medicine is that we're dealing with things from the root, from deeper within, and not bandaging it from the surface and say, okay, here's this, take it, the symptom will go away, but the root cause is still festering inside of you until the next time it comes out.
Yeah, I think oftentimes patients come in and, they may not be sleeping well. It's easy for them to fall asleep, but they're tossing and turning and they're up at 1 a.m., 3 a.m., 5 a.m. And they don't understand why. Nothing has changed. They haven't changed their diet or their exercise regime. And they don't realize that, it could be as simple as the stress that they're dealing with at work. And that stress then is creating a constriction in their intestines and not allowing them to absorb that food and convert it into the nutrients to bring that nervous system into relaxation. So at night, it would help them sleep through the night. And one of the things that acupuncture does as we're going through, how do you sleep? What are you eating? How are your bowel movements? What are your stress levels? On a level of 1 to 10, what is your anxiety? What was it before? What is it after? And when they know what they feel like in, let's say, that state of homeostasis or a parasympathetic state, then they're able to really determine or realize when they're not in that state. And the more that they use simple techniques as yoga, breath work, mindfulness, acupuncture, um, physical therapy, all of these basic tools that they can include in their lifestyle. When they see and they know what their body feels like when they're in balance, once they start to become out of balance, that waking up throughout the night or that little headache will let them know, hey, I need to do something. I need to reset. I can't just keep going, 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 because that's how we train ourselves. You have a headache, you take an Advil, you keep going because you have to put food on the table, you have to, go to work, you're accountable and responsible for A, B, C, and D. So, one of the things that we like to really implement with our patients and inpatient care is when you're doing acupuncture, it's not just a one-time thing. You need a couple of visits, one to determine what your treatment response is, um, how how you respond and how long that response lasts, and then know that it's preventative. So it's not something that you go to once a year at like your Western MD and you get your blood work, and if the levels are all in range, you come back the following year. It's something that you come in monthly, you reset your system, you remember what it feels like when you're functioning optimally and you're feeling optimal. So you'll know when ultimately when you're out of balance and you need that reset.
I always feel like when I go to the appointments with you or with any of the staff that I feel like you're all like human x-ray systems because I stick out my tongue and you're looking at my eyes checking, here and it's like, well, what do you see? What do you see? How, what is like the body just talks to you? What do you're like just scanning everything and what's happening?
It's funny because, like you said, all of these, all of these, all of these symptoms are an underlining. There's an underlining root cause, and we don't determine that root cause by just the symptom, and not one shoe or size fits all. For instance, we feel the pulse, and on the right hand we can listen to the pulmonary system, the digestive system, and the right kidney.
Wow.
The left hand, we're listening to the endocrine system and the cardiovascular system and the left kidney. On the tongue, we can see everything that's going on from the urinary bladder to the liver and gallbladder based on the color of the tongue, the size of the tongue, the coating on the tongue. We can determine if there's an excess or a deficiency based on the color of the eyes or the fingernails. A lot of people don't realize if they had spots on their fingernails that there can be a zinc deficiency, and zinc activates over 200 enzymes in the body. But we don't only just use these diagnostic techniques, we do take an integrative approach because in Florida, your acupuncture physician is a primary care physician. So they're able to prescribe, they're able to, excuse me, diagnose, not prescribe, they're able to diagnose, and they are able to prescribe diagnostic things such as MRIs or x-rays or blood work based on symptoms. And then, of course, if there's something going on once we receive those diagnostics and we need emergency medicine, there's a time and a place, and that's where we're able to refer out. So we do a lot of fun things like look at people's tongue all day long, but we also will send you in for a hair sample or a stool sample or blood work. And food is medicine. A lot of people don't realize that, we're overfed, we're undernourished, and a lot of the food that we do get in, if we're having inflammatory markers to it, that's going to be the beginning of the root cause of any of the symptoms that we're experiencing.
Yeah.
Um, Especially when it comes to, things such as anxiety, which isn't, something that you can really measure. So
And I feel like this is where my perfectionistic tendencies get a check mark of a sign of approval because when you're so used to like going through things with like a fine-tooth comb, trying to figure out what it is exactly to fix it, this is just so amazing because if you're constantly struggling with headaches or you're having allergic reactions or just sensitivities, but you're not truly aware to what, then having this kind of, like you said, the lab work in conjunction with working through the nitty-gritty of the body through acupuncture really then gets to the bottom of why we're having these seemingly unrelated symptoms that's causing a less enjoyable quality of life. Like again, back to my female clients, when they're complaining about these terrible once a week out of a month feeling. It's 12 weeks out of their year. It's how many fights with their loved ones. It's how much issues, how much time that they're not using productively, and not just productively, that they're just miserable, that could really be taken care of with proper care without having to take medicine, or Western medicine anyway, that could have its own levels of side effects and things like that, that wouldn't deal with the issue, or at least not permanently.
The amount of women that come in saying they are just overfed with Midol during their menstruation to take away the headaches and the bloating and the swelling and the brain fog and the irritability is 9 out of 10.
Wow.
And what's phenomenal is gynecologists are now recognizing the benefits of acupuncture and not just saying, we're going to put you on birth control to regulate your menstruation. There are alternatives. And what acupuncture does is it helps to create that circulation of blood flow. So by getting all that blood that's being recycled in the uterus and having it flow optimally is going to take away the bloating. It's going to relax the muscles, which then in turn is going to reduce the stress and the anxiety. And if we have less pain and we have less stress and anxiety, we're going to feel so much better during that time. So oftentimes I recommend patients to come in for the first month so we can see what their menstruation is, maybe a week post menstruation, and then get weekly acupuncture for one month leading up to the next period. And in that alone, I've seen significant changes. I personally, for my doctorate, I worked with women suffering with all of these symptoms and more due to uterine fibroids. And every time their period would come, those fibroids would implode and, creating pain levels of 9, 10 out of 10, wanting to go to the hospital.
Wow.
And not being able to either hold their urination because the fibroids were so big that they were pressing on the bladder and causing this lower back pain. And we were able to reduce the size and the symptoms of the fibroids significantly in 6 weeks. So if
Wow.
we can do that with, these benign tumors, we can do that with the ovaries and the uterus at whole, just through creating circulation. A lot of people don't realize that we recycle all the blood in our body every 60 seconds. So if we have any sludge, if we have any excess cholesterol, if we have anything that's slowing it down, it's going to affect how we're menstruating. It's going to affect our hormones through each phase of menstruation. So acupuncture is just a non-invasive way to reduce all of those symptoms.
Wow. I had no idea. That's impressive. And it's just, it really makes or break quality of life. I was just thinking that you haven't mentioned it yet, but you've done a lot of research also while you were in China, and your research was done as well in China, correct?
It was, and it is, and I'm getting ready to go back here pretty soon. I'm excited about it. The more you learn, the less you know. So I'm just keep procrastinating and adding more to my plate so I can keep going back. But yeah, my research in China is all post-COVID, and it was COVID and herbal medicine for COVID symptoms, more of the acute symptoms, mild and moderate. And I'm now currently focusing on post-COVID long haulers and myalgia, muscle pain, joint pain, fatigue, vertigo, a lot of the neurological symptoms that are associated with long haulers.
I think that's impressive, because you go there, you go and you do your research, and part of your training and it's part of your work for graduate school and it's part of just informing everybody else on this side of the world what you can learn and gather being over there. And it's not everybody does that. Not everybody makes the trip, takes the time and the dedication and the effort to go and study and learn as much as you can from the university and the centers over there.
Yeah, I'm humbled to really be at the forefront of our field here in the US. We've just started integrating the dual doctoral programs, and I know New York has it, California has it, um, Florida, we started a couple of years ago.
And what is
And
that?
then, I'm sorry?
What is that? What is a dual program?
It's a dual doctoral, so a doctorate here and a PhD in China. The
Wow.
highest level of education you can receive in the US is a doctorate. So a lot of the schools are collaborating with universities in China. So you have a clinical doctorate and a research PhD. They're collaborating with the research component for the research PhD in China until, we can pave the way here. But even when we do, I think it's important to continue to, you know, see what's going on everywhere else, because medicine is constantly evolving and changing, and staying at the forefront of it is really important.
Agreed. And it says a lot about you as a doctor that you're making that extra effort and that steps to go and be there on the front lines and be there gathering the information and learning and then bring it over here so that we can just take the benefits of that, because there's so much to be said about. One of the things is reading the books and taking the courses, and the other aspect is the experience of living through it and being able to compare how are they doing it over there versus here, and are there that many differences between us as humans and our societies, or how much of it is really, are there more similarities than we'd like to think?
Absolutely.
And with
Ab-
COVID hasn't gone away. COVID is still a topic of conversation, is a topic of concern, and like you're saying, there's a long COVID and there's the new strains that are coming out, and it's now become a part of our normal conversations, oh, someone got sick, oh, how are they handling it? Not like before, we were all very worried about it, but it's still around and it's still affecting so many individuals. And to have the option of taking care and treating COVID through acupuncture is fantastic.
One of the things I think acupuncture really is placing its name within our medical system is that when it comes to autoimmune diseases and viruses, um, you know, science has come so far, yet it's really a one size fits all. Here's a medication, here's the off-label uses for it, but if you have A, B, C, and D, this is what we're going to put you in. This is the box we put you in.
Right.
And where Chinese medicine and integrative medicine take a different approach. Granted, we're all trying to get to the same results.
Mm-hmm.
Nobody gets into medicine because they want to hurt anybody. Everybody gets into medicine because they want to help and they want to heal and they want to help us all live in our vessels on this human earth walk sojourn we get to do. But I think at the end of the day, it's imperative to realize that taking an integrative approach is absolutely far superior, because it takes the individual and the whole equals the sum of its parts, if that makes sense. It takes a tailored individual approach.
Yeah.
Kind of went on a little tangent there and circled back in, but
Okay, I speak in circles and I own
Fantastic.
it.
You might need to for that one.
Well, like I said, it's as a psychologist, I love talk therapy, but it only gets us so far. And if we don't put in any kind of body work, with the awareness, right? There has to be a level of consciousness because, you and I have talked about this before. You could do all of the right things. You could go to yoga all the time and you could meditate all the time and you could go to the breath works and you could go to the plant medicine ceremonies and you can read all the right books and listen to the right music and eat only organic and vegan and whatnot. But if you're in your mind and in your heart just feeling miserable all the time, and acupuncture, of course, and all of that, but you're still connected to being and feeling miserable, then all of those things just become things. They become, bypassing doing the work, even though it looks like you're doing the work. And I know that I'm guilty of that sometimes, where I'm looking like I'm doing it all proper, but on the inside, I'm avoiding doing the work because I'm already feeling like I'm doing it. And then when you start to recognize, wait, something still isn't clicking, something's missing, then that's when you start putting all of these pieces outside of you together to create that within you that's much more integrated and whole, which is, okay, so when I go to acupuncture and the doctor is looking at these different parts of my body that's acting up, that makes sense because that's how it's manifesting in my life through my emotions or through my energy level or through whatever, maybe the way my hair is or skin, etc., whatever issue it is I'm bringing up to the table. And then when I'm practicing yoga, I'm being more mindful about how I'm also moving around the emotions in my body and how I'm taking care of it so that I can connect more with gravity and not stretching and things like that. And that when I'm working through issues in talk therapy, if I feel the urge to cry or if I feel the anger or the anxiety, I can hold it. I can hold it without having to bypass it, and then become aware of the holding of it so that then the therapist or whoever I'm speaking with can witness it with me. And then together we begin to dismember it, let it go and transmute it and turn it into something else.
How
But
do
if,
you do that?
how
What
do I,
tools do you, yeah, like what tools do you use with patients to be able to do that?
to dismember, transmute, take the
Yes.
Barbie doll and rip up the arms and the legs
Yeah.
into the head. Um, For me, it's being present. It's being so present with the person in front of me. It's like everything else stops existing. And if something does begin to exist in my mind, I know that it's for some sort of reason that's going to connect very soon with the person who I'm talking with. Um, and I have learned to be so present, at least I could say in my therapy sessions, because of the other things that I do outside that give me that ability to recreate, like you're saying, that what was the word that you were using with the blood? The recycling, the upcycling of everything, that I can do that with my own energy because I take care of myself outside. So when I'm mindful of, okay, I'm going to yoga and I'm going to go and I'm going to be mindful of the thoughts. So if I start criticizing because I can't get a certain pose properly, okay, well, maybe it's just a fraction of an inch that had to shift in order for me to get the position more aligned. Or when I'm in acupuncture, well, that's my time to put the phone down and put my mind down from thinking about all of the things that I have to do or need to do or want to do or should do, all of that stuff away with the phone. And when I'm flexing my mind muscle and I'm allowing my heart to feel, then I could be so present with that client or with that person that we just enter into this vortex. We're entering into this space where we can recreate some scenarios and have these feelings come up where I can hold, or at least that's what I hope the other person's feeling. I'm holding it and then we're transmuting it to become and mean something else for them.
I
And
know, I'm
yeah,
sorry.
no, it's okay. Yeah.
I know that for me, one of the tools that you suggested was painting and drumming, and that really resonated with me. And it's something that I am, excited to do to really get those emotions out in another way. And that's an individualized, um, tailored plan for me, I presume. But I assume that these are also tools that you implement in your sessions with clients.
If it comes up and that's what they need, yeah. Yeah. Because like you said, a lot of the stuff that we feel is pre-verbal. It's from when we're very little. And what better way than through music and sound and the tactile with the painting or with Play-Doh or silly putty or whatever to get that stuff coming out. But I couldn't even come up with that kind of a suggestion prior to doing any body work because this wasn't taught in graduate school. This was never talked about in clinical psychology. I think I'd be laughed at if I asked to do something like this in graduate school. Like, what are you, 5? Maybe.
Yeah, that's I feel as though that's what people need. And when you talk about, it not just being talk therapy and really giving people tools and outlets and resources that, aren't just outside of themselves, such as painting or singing or dancing or chanting or, so on and so forth. I think that's amazing.
Thank you. Well, because it works. And the more research that we do, we see that it's really not that separate. If the emotions are neurochemicals that live inside of our body, right?
Yeah.
Then of course, like you were explaining, the acupuncture points and the way that the tongue looks, I just love it. I love going. I'm 5. I'm really 5. Um, but back to me being serious. But the fact that it's so interconnected, it makes so much more sense that we don't have to be circling around the issue or banging our head against other different doors to try to find the solutions to our problems. It doesn't have to be so complicated. The information's out there, and when we're looking at things holistically and we're doing integrative type of work, then the solutions come so much faster because they're already there. They're already there for all of us. And I think it's amazing that you work with the age span so that a frustrated or scared or worried mother doesn't have to wait for her child to grow up, or that person doesn't have to wait to say, maybe I should try acupuncture. Maybe I should look at Oriental medicine to see, because I don't like how I'm feeling with this. Or maybe Western medicine's good, but there's something lacking. Well, it is what it is. Just live with it. Or someone who's in their later stages in life, that they can enjoy that part of their life as well. I don't think we're meant to be here to suffer. And the fact that you also have your nonprofit organization, I mean, it's open to anyone then.
Yeah, when COVID hit, a lot of our patients, they lost their jobs, they lost their health insurance. Um, the veterans that we had couldn't get it back into the VA because they needed authorizations, and the VA was closed for them to do that. And like I stated earlier, I got into this because I wanted to help people, and the limitations that transpired with COVID just really set me back. So it was beautifully and humbling and challenging, getting everything in motion, but we're there and it's evolving, and it is really a platform to not only create accessibility but awareness, because there are so many people that just don't know they have options, and there are so many resources out there, and acupuncture is definitely one of them. So yes.
Yeah. And it's also covered by insurance.
So Acupunctures is not, because it's a
Oh, no.
nonprofit.
Acupuncture is not, but
But Eastern Acupuncture, but acupuncture is covered under insurance, Medicare and Medicaid. It's covered under Medicare as well. There are, um, we take United Healthcare, Cigna, Blue Cross Blue Shield, Memorial, and the VA. And then, we're in network with other plans depending. But yeah, we're we're able to offer to everyone, everyone that has insurance. And that's the change we want to see, and that's what's gonna bring it really to the forefront of our communities.
amazing. It's great. It's great. You're helping the world be a better place, and I love it. And
I actually, I wanted to say one more thing. When we're all here just trying to navigate this thing called life, right? And we have these vessels that we're sojourning in, and we put wear and tear on them, whether physically or emotionally. And it when one person feels better, they're better to their children, their wives, their partners, their lovers, their workers. They're better in their communities, and it's a ripple effect.
yeah.
So we are part of that universal cause and effect of spreading love. And at the end of the day, when people ask me, "Oh, what do you do?" It's like I give people hope and I allow them to live. I help them to navigate this sojourn because they feel better, and if they feel better, everybody around them feels better. So I love what you do. I am honored to share in this journey with you. I'm so thankful that you gave me an opportunity to come and talk with you today.
I mean, thank you, but the pleasure's all mine. I'm very grateful to you. I hope you see, I think you do see how amazing of a professional you are, and that much more of a human that you are, and that carries through the work that you do, because um I know you as the doctor, and I know you as the friend, and the doctor that comes into the office and holds that space when I could say something and have a feeling around it. And you hold that for me. Not every doctor does that. Not every doctor takes the moment and listens and starts thinking and putting two and two together to see, okay, well, this is what she's going through. What's going to be the best course of action for today? It's not just a run-of-the-mill protocol, like, these are the 5 points, this is good, next. It's you really take your time to be so diligent and precise about what your patients need, and that's priceless. That's priceless. And I thank you so much for that, because it makes me that much better. And like you said, it's the ripple effect. The better that I can be, the better everybody around me gets that part of me. So thank you. Thank you also. And thank you to your staff. And you have 2 locations in Wilton Manors and Plantation.
Yep.
And we will put your information at the end of the talk here today, so people can reach out to you and yeah, and book an appointment, because it's just wonderful. Thank you so much.
Thank you, Dr. Eva.
You're welcome, Dr. Cruz.